Hi, it's Dave with Utah Physical Therapy. I thought on this video I could explain a couple of ways that you can look and see if you are having headaches caused by muscle tension. Muscle tension causes a lot of headaches, tension headaches that start in the back of the neck and work their way up and forward in your head. And here are just 3 ways that you can figure out whether your headaches are caused by muscle tension. If they are caused by muscle tension, they respond really well to stretching, exercise, and physical therapy. So the first thing you can do is go through some range of motion with your neck. If your range of motion is restricted, then there's a good possibility that the muscles are tight, contributing to your headaches. So this is Jocelyn. Jocelyn's our new PT student. She's from Rocky Mountain University in Provo, and she's going to help us out demonstrating these. So I'm going to have Jocelyn go through some range of motion. You can tip your head all the way forward, all the way to your chest. Good. And then bring your head back as far as you can go. And what we're looking at with these is if you feel any tightness, any pain, if you feel like it's restricted in your range of motion. So now take your ear to your shoulder. You should be able to go around 40 degrees, 45 degrees. That looks pretty good. Try the other side. Looks pretty good. And then rotating to one side as far as you can go, and rotating to the other. You should be able to go almost to your shoulder with this. So if any of those feel like they're tight or they start to reproduce your headache symptoms, it's a good indication that that's probably contributing. Number 2 is you can push on the muscles right at the base of your skull. So right here at the base of the skull are where some muscles go around the nerves that go up and over your head. So if those muscles are tight, then they can pinch on those nerves and cause your headache symptoms. So just putting some pressure right at the base of your skull and putting some good pressure and seeing if that either relieves or causes a headache, that can be helpful to determine whether or not that's where it's coming from. Did that cause a headache?
No.
No, we're good. Okay, number 3, this is a test to see the mobility of the upper part of the neck. The upper part of your neck has 2 vertebrae that should be able to rotate on each other fairly easily. If the muscles are tight in that upper part of the neck, it can restrict your range of motion. So what you're going to do is you're going to bring your chin all the way down to your chest, and while you keep your head forward like that, you're going to rotate your head to one side and then the other, looking for a difference between the 2 sides and looking to see if your range of motion is good. You should be able to go all the way almost to your shoulder with your nose. So if your nose is pointing to your shoulder, you're what we consider normal. And if you can't go that far, keeping your head down, then you probably have some tightness in the upper neck. So those are 3 easy ways that you can check and see if you have muscle tension that may be contributing to your headaches. If you do have any positive signs with these tests, then you have tension associated with your headaches, and it would respond really well to physical therapy. Feel free to call us for a free consultation, and hopefully you can get those headaches figured out. Thanks.